Hello learners, this is Sam from Tixe Schooling, and we are going to start a new series of lecture on the thoracic region, including the thoracic walls and thoracic boundaries and pericardium, lungs, and everything that is related to your thorax, and we are going to talk everything about in this series of lecture. So we are going to start with our part 1 of that series, that is about the thoracic wall or thoracic cage and its boundaries, and especially we're going to talk about the sternum and the angles which are included in the sternum and the parts and the joints which they make. So let's get started with our lecture, and we are going to start from the structure of the thorax. So in anatomical sense, the thorax, let me be specific about it, and let me isolate that region for you. Here we go for the thorax. Let me add upper limb to it, alright, so you can see it properly. Okay, this is it. Alright, so this is the thorax, alright. So according to, in the anatomical sense, the thorax, our chest, is a region that is between the neck, this is your neck, and the abdomen. Here your abdomen, the diaphragm lies, which we cannot see here, but if I add some muscle to it, you can see that this is the abdomen. You can see that the diaphragm, it separates the abdomen. So this region downward separates the thorax from the above side, and over here from that first rib we have got we have this actually the suprapleural membrane, which we're going to discuss in later on, which actually create the thoracic region. So this is the concept of thorax. So which thorax or chest is a region between the body and the neck and abdomen. So which is actually flattened in front. You can see that this is actually flattened in front, and behind it's by the sides it's rounded. You know, in the children's, it's not actually, the ribs are not rounded, but as we get older and older, our ribs will get rounded. On the behind, it's also somehow flat. So you can use a term that it's flat on the behind and in the front, and rounded on the sides. And now let's talk about the thoracic boundaries, or the cage boundaries, the thoracic cage boundary. It's kind of a cage, you know, it's closed, so that's why we are calling it the thoracic cage. And let's use the boundaries. Behind, we have got the vertebral column. You can see this one. This is the vertebral column, especially the thoracic from T1 to T12. The thoracic vertebra, especially in the vertebral column, we have thoracic vertebra, which is actually forming the behind or the posterior region of the thoracic cage. On the front, we have got the sternum and the costal cartilages, which are actually not shown here, but I have. Let me see that. We have got muscles. Now it's not in the muscles. Let me use the connective tissue. In a sense, we may find it. Okay, you can see this. So these costal cartilages, you can see here, which are highlighted in the green, are actually are forming the front, not the sides. Remember this one. So if we are discussing the front of the thoracic cage, we have the sternum and these costal cartilages, and we have joints in between. And then we're not going to discuss in this lecture today. And on the superior side, we have got the suprapleural membrane. Over here, we got suprapleural membrane superiorly. On the sides, we can say we got the intercostal spaces on either side, these intercostal spaces, and the ribs. And below, we got diaphragm, which we have already seen. So simple to understand. On the posterior side, we have got the vertebrae anterior. On the front side, we've got the costal cartilage and sternum. On sides, we got ribs, and below, we got the diaphragm, and above, and superiorly, we got the suprapleural membrane. And let's move further and see that in thorax in a bit different sense. So consider that thorax is actually divided into two parts. You know, anteriorly, you just imagine that it's divided into two parts. The lungs and pleura actually forms side of the and inside. You know, inside we have divided the thorax into two parts. That's the mediastinum and the lungs and the pleura. So what happens? The lungs and the pleura forms the sides. You know, they are located on the side. Over here we have lungs. Let me see if we get lungs over here. We have got respiratory system, right? All right, you see that these there you go with lungs. So these lungs, and over there we have the pleura over them, which is a serous membrane. If you don't know what is pleura, are you pleural membrane and the pleural cavity, you must check out our video in order to understand the concept of pleura, which actually surrounds and protects and make it frictionless, for the lungs when they expand. And the area between lungs, we have divided lungs into two parts. We have divided the internal of the thorax into two parts, that is mediastinum and the lungs and pleura. So lungs and pleura goes on side by side, and in between we have an area where you can see that this is the left lung, this is the right lung. You can see that by the this notch, which is called the cardiac notch. And this area in between is called the mediastinum. So mediastinum is basically an imaginary area which has its boundaries, like sternum. On the posterior side, we also have boundaries. We also have a video on the mediastinum. You can also check that out and understand the concept of the mediastinum. Especially in this area, in the mediastinum, we have got heart, we have got thymus gland, we have got major vessels, nerves, and veins passing through this area. So it plays a good role. We have also divided the mediastinum further into superior and inferior. We're not going to talk about that one in this lecture. We've already made a video about it. And let's move towards the sternum, and I will better explain the sternum on the you must see the diagram over here of the sternum, but I will better explain the sternum on the paper diagram. So I think that would be easy for me to explain the sternum. So just view the sternum in this area. Just let me isolate this sternum for you. Okay, here we go with the sternum. So this is the sternum. You can see the sides of it. Here are the attachment for the vertebrae. I'm sorry, here's the attachment of costal cartilage, which are actually attached to the actually attached to the ribs. Over here we got we have got the clavicular notch, and over here we got the attachment of first rib bone, that is T1 thoracic bone. Let me explain it on the paper, so that would be better. Let me give you another. Let me just explain it for here. This is the anterior part, this is the lateral side, and this is the posterior side. Let's move to the paper side now. Alright, let's start with our sternum, which actually lies midline of the anterior chest wall, which we already have seen. So it's actually a flat bone. It's not that much flat, but we consider it as a flat bone according to a book called Snell. We have taken the reference from that book. So the sternum, which is divided into three parts, that is the upper part, which is the Manubrium. You can see it here, the Manubrium. The middle part is called the body of the sternum. We haven't mentioned the sternum, so it is the body of the sternum. And in the end, we have got a cartilage which actually ossify later on, and which is called the Z5e process. So I start with the lecture of the Manubrium. So Manubrium is actually the upper part of the sternum. Upper part of the sternum. So here it forms a joint, Manubrium, in the body of the sternum, called the Vertebrosternal joint. So this joint, we haven't mentioned that. All right, let me mention this one for you. Here we got a joint. This is an angle. We are going to talk about the angle just in a bit later. But let me mention that this is the Vertebrosternal joint. All right, the joint between the body of the Manubrium and the body of the sternum. So it also, and on the other side we can see that we have already seen that over here it actually articulates with the clavicle, which is also called the beauty bone. So that this over here there's a notch which is called clavicular notch, where the clavicle actually attaches, and over here we got the first costal cartilage attachment on the sides, which is actually can be seen in this manner. Here the first thoracic costal cartilages, the rib costal cartilage are going to attach, and this is the bit concept about the Manubrium and understanding the Manubrium. If you're seeing the Manubrium in the front side, this is the anterior body. Consider this is the posterior side of your body, and this is consider this is the posterior side of body. This one, and this is your vertebra. This is the thoracic vertebra, and this is the consider this one as the anterior part, which is the sternum. So this is what is called the Manubrium. Over here we got the vertebra from T1 to T12, the thoracic vertebra. So Manubrium actually lies on the behind, on the posterior side. If you go parallel to this one, you find that if you go perpendicular to this one, and I mean you go this way, and I mean parallel to this one, you see that it actually is opposite to the third and fourth thoracic vertebra. Thoracic vertebra. This Manubrium is opposite to the third and fourth thoracic vertebra. And now let's talk about the body of the sternum. So the body of the sternum, again, it forms the joint above here, similar to that one there, which we have already talked about, that is Sternal Joint. But we got another joint over here, which actually forms with the Z5 process. This is a which is actually a cartilage. So this joint is called the Z5e Sternal Joint. Let me mention this one as well, which you can say that Z5 Sternal Joint. All right, we are good with this one, Z5 Sternal Joint, which actually lies opposite from the other vertebra. And over here on the sides we have the attachment of the costal cartilage from 2nd to 7th. Remember this, from 2nd, because the first one is going to attach here, but from here, from the 2nd till the 7th are going the costal cartilage, which are actually attached to ribs, are going to attach over here on this on the body of the sternum. And remember that we haven't got any costal cartilages attached here on the Z5 process. No costal cartilage on the Z5 process. And we already know that we're going to talk about that one as well, that the 8th, 9th, 10th are the costal cartilages of those are actually going to attach with the costal cartilages of the 7th ribs costal cartilage. We're going to talk about that one as well, but in another series of lecture. So now we have just talked about this the Z5 process, which is actually a cartilage, so which actually becomes ossified at proximal end, as we get older. So actually, and one thing more, we have already talked about that no ribs are attached here. Now let's move towards the sternal angle, which is mentioned here. So it's also called the angle of Lewis according to the book Snell. So which is actually between the Manubrium, this is the Manubrium, and the body of the sternum. So they are a bit tilted, not that much, but bit. I mean, let me just show this like this, little bit. I mean, you can see this like this. Consider this as a Manubrium. Consider it as consider this one as this hand as a Manubrium. This as a body. So this is like this one, bit tilted backward, like backward. You understand that? Like, you get it? So between the Manubrium and the body of the sternum, so this you can feel the transverse ridge when you have a bone in your hand. We are going to talk about the sternum bone. We have already talked about the sternum bone in another lecture, in which we have shown the bone that there is a transverse ridge at its which is a recognition of this sternal angle. So this transverse ridge actually lies at level of 2nd costal cartilage and the point where all the costal cartilages are contented. I'm sorry, I don't know what I said, but so this actually costal cartilage actually is opposite, or you can say where the 2nd costal cartilage is going to attach. It's halfway, somewhere like this one, and which actually, and this one, this angle lies opposite to the intervertebral disc of the 4th and 5th thoracic vertebra. This angle lies opposite. I have already talked about what its opposite mean on the vertebral side, which lies actually opposite to the 4th and 5th, in between the 4th and 5th intervertebral disc. So this is all about the first part of the series of lecture on the thoracic cage. We are going to discuss more about this one later on. Please keep in touch and make sure you don't forget to ask anything. We are also going to start another series of lecture on pathology, and we have really good member of Tixe Schooling, which we are going to introduce very soon to you. So please feel free to ask if you want to ask regarding the pathology, biochemistry, anatomy, or any field. If you in a medical field, any field, if you feel like you need help, please don't forget to ask. Thank you for visiting Tixe Schooling, and keep coming, and do comment us for anything. Thank you.